Welcome to Let's Eat. I'm your host, Emily, holistic health coach and self-proclaimed wellness enthusiast, here to meet you at the intersection of physical and mental health, the exact location where optimal wellness lies. This podcast is meant to explore all areas of mind and body wellness, designed to offer you the integrative knowledge, behavioral strategies, and mindset shifts necessary to uplevel your health and feel better today. We'll explore nutrition, sleep, movement, self-care and stress management, habits and routines, gut health, mental health, and more. I am so happy that you're here. Welcome to the table. Let's eat. Hello, everyone, and welcome back to Let's Eat. As we move through Mental Health Awareness Month, I'm continuing to explore different areas of mental health and offer you a well-rounded approach to mental health and mental health care. And so today's guest, I'm welcoming Dr. Michael Gentile to the podcast. He is a nutritional psychiatrist who is based in New Jersey, and his approach to mental health care is definitely more holistic than we see in modern psychiatry. Dr. Gentile believes in the use of medical marijuana, ketamine, and psychedelics as being part of potential treatment for mental health. He's also big into the mind-body connection, using food as medicine for mental health, metaphysics for mental health, right, spirituality, and so forth. And he really offers this well-rounded approach to mental health care. And I was so excited to sit down with him and talk to him about it because for me personally, this is an area of mental health. This is an area of health, I'll be more, broad there, that really interests me so much because this is essentially where I started, right? Food for mental health, food as medicine for our brain, our gut, and so forth. And so really being able to explore this with him in practice and then also talk about maybe these more non-traditional, a little bit controversial areas of treatment definitely widens our scope and understanding of what the potential for our future looks like in terms of mental health and how he uses these approaches regularly in his practice, maybe a lesser dependency on medication. He believes obviously there's a time and place for medication, but he also sees these other avenues to support his clients. And I think that's really cool. And I think we're going to continue to see this in the mental health field in the next 5, 10, 15, 20 years, especially as more research is explored and expanded on, and the benefit of it all really comes to light. So thank you so much for being here. I hope that you enjoy this episode. Let's welcome Dr. Michael Gentile to the table and let's eat. Hi, Dr. Gentile. How are you tonight?
All right. Very good. How are you, Emily?
I'm great. I'm super excited for you to be here, for us to have this conversation, and really, really important. So thank you for being here tonight.
You're welcome. My pleasure.
So let's dive in. What got you into psychiatry? Tell us about your background. Give us the scoop.
Psychiatry. Well, how did I get into psychiatry? Wow, that goes way back. Uh, I knew I wanted to be a physician.
Okay.
But when I got into medical school, I realized I had a bigger decision to make, and that was what kind of physician.
Yeah, sure.
So I flip-flopped among several specialties. I actually trained as a surgeon. I thought I was going to be a urologist.
Okay.
Didn't like that. Did a surgical internship, and then afterwards, knew in the back of my mind that psychiatry was kind of my backup plan. I kind of I liked it. Some specialties I ruled out, but I knew psychiatry I kind of liked. Was kind of interesting. Was a
Okay.
challenge. Was different. So that's how I got in. But I started out as a surgeon. I mean, I wanted to be a gastroenterologist at one time. I
Oh,
wanted to
wow.
be a orthopedic surgeon, be the team physician for the New York Rangers, and then eventually urology, and then eventually psychiatry. So I've considered several options, but I think I made the right choice.
Good. Okay. Yeah, it sounds like you were all over the board there.
Yeah, oh, definitely back in the day.
Yeah, but what a decision to be made. It's good that you had the opportunity to kind of feel out the areas that you had available to you. And then it sounds like you made the decision that you felt most aligned with.
Yes, absolutely. Yeah. Yeah. So.
So, what would you say are the cutting edge practices to mental health care? I'm very interested to hear from you and your experience and your work with clients. What would you say is cutting edge?
Well, cutting edge would definitely have to be what I do, and that's
Yeah.
psychedelics, intravenous ketamine, and medical marijuana.
Hmm.
Um, these are the cutting edge fields. There's been several FDA designations of breakthrough therapy, I believe, with several of the psychedelics, MDMA being the first,
Hmm.
may also be the first one released. We'll see. They filed for FDA approval. If you're familiar with this organization, MAPS, Multidisciplinary Association for Psychedelic Studies, they have MDMA. For many years they've been through clinical trials, and it's kind of ended, and now they've actually filed. We're waiting for the verdict. The FDA
Okay.
word.
Yeah. Yeah.
Psilocybin for treatment-resistant depression, major depressive disorder as well. LSD was the new one recently in the past
Mm.
month for generalized anxiety, was given FDA breakthrough status. Um, yeah, so these are the products. Now these products are proprietary. They're being processed through the traditional conventional way
Okay.
that a pharmaceutical would. So
Okay.
these are products. These are publicly traded companies, psychedelic pharmaceutical companies that have a product and are undergoing the traditional clinical studies, stage one, two, three, and then you apply for approval from the FDA with all your data. And so now the legality of these medications, they're Schedule One. That remains to be seen. What actually transpires after the FDA has given its approval, it's still illegal. Then what? Then the departments in Washington, D.C. have to battle it out. Basically, this is what's going on with marijuana right now.
Yeah.
Health and Human Services has decided that it's worthy of Schedule 3 being downgraded. Now the DEA, though, is looking to make their decision on it. So, but the other possibility of cutting edge therapy in the state of New Jersey is that in the legislature there is a bill. It's undergoing debate. It will eventually have to be voted on, and then there's an 18-month development period before it's rolled out for psilocybin therapy
Hmm.
in a therapist's office. So,
Okay.
but we're still about 2 years away from that. Hopefully, these products will have them before. So, but yeah, but what do we have available now that's legal?
Yeah.
Intravenous ketamine, the only legal psychedelic, and that's what I
Okay.
do at the Wycliffe Wellness Center. Intravenous ketamine, definitely the way to go. You've heard of, I'm sure everyone's heard about Matthew Perry, that he
Mm-hmm.
overdosed on take-home ketamine to be
Okay.
distinguished from doctor's office, where you're
Sure.
monitored EKG, blood pressure cuff, pulse oximeter, heart rate for the entire psychedelic trip. That's the way to do it. No take-home ketamine, very dangerous to be given
Sure.
to patients. And
Yeah.
Matthew Perry, he took, the doses based on weight. I'll use maybe 50 milligrams, say, to 100 milligrams. He took 500 milligrams all at
Oh my
once,
goodness.
and did
Okay.
what it's supposed to do. Put him to, and anesthetized him. But you're
Mm-hmm.
not supposed to be doing it in a hot tub.
Sure.
So he fell asleep, and he drowned in his hot tub. So
Yeah.
yeah, so that, and medical marijuana. Let's put in a good word for medical marijuana. It has changed the way I practice.
Yeah.
I
Okay.
no longer use harmful benzodiazepines and sleep
Mm.
Ambien and Xanax and oxycodone and Vistaril and hydroxyzine and Benadryl. These are all damaging to the brain. Medical marijuana helps us eat, sleep, relax, protects the brain, helps us forget, very good for PTSD, and it's also good for pain. So
Yeah.
it's kind of
Okay.
changed the way I practice. So I think that these are the cutting edge. Intravenous ketamine. There was a head-to-head study with electroconvulsive therapy, shock treatment, ECT, and it showed that intravenous ketamine to be more effective safer, no side effects, or minimal side effects compared to shock treatments where you lose, your memory and hopefully all of it comes back,
Sure.
no guarantee. And you don't light up your brain and induce a seizure, and you light up every neural network, and that's how ECT works.
Okay.
Ketamine works by rebalancing, resetting the brain. Certain areas like the amygdala, the fight or flight center of the brain, is actually shrunk, and
Sure.
the hippocampus for learning, memory, attention, and mood, that's actually increases in growth. So it rebalances, resets your brain. Uh, the only substance, let's say there's been three substances ever proven to prevent suicide attempts.
Okay.
Ketamine being one, the other two being lithium and clozaril. Though their side effect profile make them prohibitive to prescribe routinely. Uh, every oral antidepressant, mood stabilizer that you've ever heard about, there's a warning that they may increase thoughts
Sure.
and
Yeah.
behavior, you know.
Yeah.
So
Yeah.
so we have a winner with ketamine, and hopefully psilocybin, LSD, MDMA will have those as well.
Okay.
That's the gutting it. Yeah.
Yeah. Very, very fascinating. And I'm sure controversial
Oh
to
yeah,
some
yeah, very,
extent.
yeah.
So you mentioned you've kind of noticed a shift in your practice in terms of what you're prescribing because
Yes.
of these
Yeah,
new
yeah,
options. So
yeah, yeah, yeah,
say in 10 years,
yeah,
do
yeah.
you foresee yourself foregoing the use of pharmaceuticals for the sake? I mean, obviously, I'm sure there are cases where there's relevance and everyone's specific and there's needs, individual needs and so forth. But given the efficacy and what you're seeing, do you foresee a completely different world in terms of pharmaceuticals as it relates to mental health?
Well, it's always good to have all tools available to me. I like to say
Sure.
that all tools available to me. So there will be further refinements in traditional pharmaceuticals, and I mean, for psychedelics, ketamine, medical marijuana, but there's no treatment for schizophrenia,
Hmm.
bipolar mania. So we still need pharmaceuticals for
Sure.
the severe psychiatric illnesses. So I don't foresee, traditional pharmaceuticals going away anytime soon. Yeah,
Sure.
we need them. We need them. We need everything, and
Hmm.
yeah, available at our disposal. So
Yeah. Okay.
yeah,
Yeah, very, very interesting.
uh,
So let's take a few steps back now that
yeah.
we've talked about maybe some of the more
Hmm.
non-traditional
True.
approaches to mental health. We'll take a
Yeah.
few steps back and talk about maybe food as medicine for mental health.
Yes.
Still
Yes.
not totally traditional, right? But still something that's a little bit more accepted in the mental health field. So let's explore nutritional psychiatry. I'd be
Absolutely.
very interested to hear your definition and kind of explain how that works.
Well, interesting you bring this up because recently there's been a study using the ketogenic diet
Hmm.
to improve chronic psychiatric illness. The theory being that the absence of carbohydrates, sugar, will reduce brain inflammation. Brain inflammation seems to be the root cause of all mental cerebral brain illnesses,
Sure.
the way it is with all chronic medical conditions as well. So a ketogenic diet, you reduce your pro-inflammatory food intake and resort to ketogenic diet is a moderate protein, but I believe it's a high fat
Yes.
diet. That the good now we want to emphasize the good fats, omega threes
Sure.
specifically, not the canola oil, the omega six, and a moderate but very low carbohydrates.
Right.
Now, this is not an exact science, so I counsel patients that I do recommend the ketogenic diet just because it reduces inflammation, and now we have proof that it's helpful for psychiatric illness.
Sure.
Um, but I think it's sustainable. I mean,
Hmm.
you could have a steak, you could have a salad, you can't have the bread, you can't have the pasta, the rice, the crackers, the chips, but the steak is filling,
Yeah.
you know, not meant to. So vegetarianism, veganism, we should speak about that. Problem with vegetarian veganism, you have to know what you're doing.
Yeah.
Uh, the problem is finding reliable plant-based protein sources.
Mm.
That's an issue where
Mm-hmm.
steak and egg, you got it all there.
Yeah,
That's number one. The other things is you've got to supplement with B12 and folate and
totally.
zinc. B12, folate, zinc, best found in animal proteins, not found readily in plants. So
Sure.
you got to know what you're doing. And if you have your right to be a vegan or vegetarian, no one's going to take that away. But you don't want to end up with B12 deficiency and with neurological illness.
Sure.
So
Yeah.
this is a danger for vegans, vegetarians. So
Yeah.
yeah, I couple the keto diet with intermittent fasting and
Okay.
apple cider vinegar, which I'm drinking right now
Okay.
on the rocks with water to dilute.
Okay.
That's
On
the
the
way.
rocks.
That's my drink.
Yeah. Okay. Tell me why.
Apple cider vinegar supercharges the ketogenic diet, the intermittent fasting, lowers blood sugar,
Sure.
burns fat, balances when you're fasting, especially. It's very helpful. There's two different theories. You could take it. If you take it in the morning, I believe you can burn fat. If you
Mm.
take it at nighttime, it stabilizes your blood sugar through the night
Sure. Sure.
and
Okay.
and, and helps with a lot of night sweats and interrupted sleep, that you
Okay.
may have with spiking blood sugar.
Okay. Very
So
cool.
so this is, I mean, it's recommended 3 times a day, but the taste, the convenience, if you take it once a day, good enough.
Yeah.
And other ways, you just put it in your salad, just
Yeah. Oh, yeah. Make a
put it
homemade
in your salad,
dressing or,
put it in
yeah.
your salad, sort of thing.
Yeah.
So yeah, so keto intermittent fasting is interesting. So that is a better way to actually lower your blood sugar. So the body has a
Mm.
order of energy sources. So if you're consuming food, alcohol, your body will resort to what's available, what's easy, what's available,
Yeah.
the blood,
Sure.
the blood sugar, the nutrients, and even the alcohol. The body will use first to burn energy as an energy source.
Sure.
Uh, so the idea is to lower, theory, to lower the blood sugar so the body doesn't have that option by having a ketogenic diet, but you're getting your omega-3s and you're getting your essential amino acids as well.
Right.
So we don't need carbs.
Yeah.
Carbs are just quick energy. When we talk about the food pyramid, right?
Mm.
About the food. What are your thoughts on the food pyramid?
Oh, just a bit outdated. That's all.
My understanding it was an advertisement for the agricultural industry. And,
Yeah.
and they voted again, they just disregarded any medical advice and
Sure.
we should all eat uh,
Yeah.
Cheerios. We should all
Yeah.
eat
Right.
cereal and dry cereal and we should have candy for breakfast,
Right.
basically.
Right.
Yeah.
Right.
So,
Yeah.
um,
Well, I couldn't agree with you more on
yeah, yeah,
I mean, ketogenic, I have a hard time with the word ketogenic, I think because there's connotation that comes along with it. But I
yeah,
do
yeah,
believe
yeah,
that we are not getting enough omega-3s. I know that's an
yeah.
enormous
Uh,
deficiency and we need that. Our brain is 60% fat, so absolutely. And the amino acids, without a doubt, neurotransmitters, all of the important things for mental health. And what you were saying about veganism and vegetarianism, I think that this is a big issue because
yeah,
deficiencies are so
yeah,
widespread,
yeah,
and
yeah.
we're eating these faux meats,
Yeah,
these
faux.
plant-based, foods that are full of, God knows
Yeah.
what. And we have deficiencies in what you're saying, like B12 and folate, and
Yeah,
you
yeah,
had mentioned zinc. So,
yeah,
being really intentional about how you're choosing to
yeah,
nourish your body.
yeah,
Everyone's
yeah,
entitled to their
yeah,
own choices in that regard, but being educated and being well
yeah,
informed
yeah,
at
yeah,
what
yeah,
risks could there
yeah,
be when it
yeah,
comes to deficiency.
yeah,
Absolutely.
yeah.
100%.
The pecking order, just to finish the thought, the pecking order. So then body then will, after there's nothing in the blood, so the body will tap into the liver and muscles for quick energy source. But that's very limited. Then it taps into the body fat. So that's the goal, to
Mm,
tap into the body fat for energy source. So we have to
sure.
deplete all other options for the body so that there's nothing left but body fat.
Okay.
That's how. I mean, you got to be careful with fasting too, because when you do fast, you're not only burning body fat, you're also losing muscle,
Sure.
and so you want to develop a routine that works for you and
Yeah.
how you incorporate. If it's a 24-hour fast, one meal a day. If you skip one meal, skip lunch, breakfast, and you have that 8-hour window you eat and 16 hours fast, whatever it is. There was a bogus study that came out. It said that intermittent fasting can cause heart attacks, kind of thing.
Mm.
That was a questionnaire. That wasn't even a study. It was a questionnaire sent retrospectively to a bunch of people, and they asked them, "What do you eat for dinner?" Like a year ago. Oh, I eat this. I eat this. Oh, intermittent fasting causes heart attacks.
Oh
That
my
was totally
goodness.
bogus. That was
Yeah. Yeah. So is this predominantly how you work with clients in terms of if you're approaching it nutritionally? Are you recommending intermittent fasting and ketogenic living and so forth? Is that kind of the approach that you take?
it's more difficult for patients to adhere to a healthy diet than it is for them to take harmful medications with a lot of side effects.
Sure.
It is very difficult.
Yeah.
The odds are stacked against us.
Yeah. Sure.
We're inundated with commercials for junk food. You go to any sporting event, it's just one big beer junk food commercial.
Sure.
Nothing. So we're inundated. Anything you see advertised, you don't want, and then
Yeah.
you work backwards from there. You have anything with ingredients like a food package, processed food package product
Sure.
sold for profit, not for nutrition.
Mm.
You don't want. You want
Yeah.
chicken. You want lettuce.
Right. Right.
So it's a process. It's where the patient is on their journey.
Yeah.
You have to
Yeah.
kind of meet them at their level. If it's
Yeah.
adolescent, that they're eating Doritos and kind of
Sure.
Coke, I mean, what can we do? I mean, you have
Yeah.
to really, it's a slow process, slow, steady, reminding, kind of
Yeah. Yeah.
encouraging, kind of, uh,
Yeah.
it's difficult. It's difficult to get people to change their nutritional habit. Things are so
Yeah.
easy. And in this country, it's all about fast food,
Yeah.
There was a study recently came out about the percentage of ultra processed foods that each country utilizes part of their diet.
Yeah.
And we were like the highest at 58%
Of
of
course.
American diet is ultra processed food.
Yeah.
I'm proud to say Italy, the lowest, 15%.
Mm. Okay.
South Korea, not too bad. I think 35% or something like that. But US just, 58%.
Yeah.
Well,
To no
what,
surprise,
what can we
you
do?
know.
What can we do? Look, Michelle
Yeah.
Obama, the first lady, she tried to uh, advocate for school lunches and healthy.
Yeah.
She got nowhere. She was
Yeah.
kind of beaten down by
Yeah.
by the
Yeah.
food lobby. I mean,
Right.
it's impossible. Yeah, it's impossible.
Yeah, and I can empathize with you on that because when I worked as a therapist for about a year and a half, I had the same experience with clients where while I wasn't able to offer them medication, they weren't interested in hearing about food and they were
Yeah, yeah,
interested in hearing about making these changes. And,
yeah,
I honestly felt a lot of frustration from that, but I
yeah,
also had to acknowledge that this is where they were on their journey and I couldn't expect them to be any farther along and maybe a
yeah,
year from now or maybe down the line or maybe never, who knows, right? But
yeah.
it was one of those it was between a rock and a hard place to sit there knowing so strongly that what they were eating was impacting how they were feeling. And then also knowing I have to respect and ethically honor the fact that they are where they are in this journey and all I can do is meet them there.
Meet
And
them.
so that was a big, big frustration that I think I may have shared with you when we first spoke, because I feel so passionately and so fervently about the connection between food and our brain and our gut
Right.
that, it was really hard to step away and be patient with that, knowing what it could do, you know?
Absolutely. Yeah.
Yeah. So speaking of the gut, I'm
Yes. Yes.
curious to hear thoughts
Yes.
on
Yes.
the gut brain connection.
Well, the gut brain, there are serotonin receptors in the gut and the brain. I think there's more serotonin receptors in the gut than the brain. Actually, we call it our second brain.
Mm-hmm.
There's a connection between the two.
Sure.
We need a healthy gut flora for us to be healthy. That comes from a variety, eating a variety of foods. It also comes from supplementation, judicious supplementation, probiotics or prebiotics. So the prebiotic is the fiber and food that the good bacteria eat, and the probiotic is actually the good bacteria that just kind of flood the colon with a good bacteria, a good quality probiotic. You got to be careful with the probiotic. Judicious use. You don't have to take it every day, actually.
Hmm.
You definitely want to take the probiotic. Definitely after a course of antibiotics.
Oh,
And
sure.
and routinely, physicians, it's not emphasized, take a probiotic when you take your antibiotic. I do,
Yeah.
but not every doctor does. And the theory is that the bacteria doesn't discriminate in good, bad. They'll just wipe
Yeah.
out all your bacteria, good and bad,
Sure.
and then you're stuck with all kind, especially a severe complication called pseudomembranous colitis. If you're familiar with that, it's a bad infection of the bowel due to the overgrowth of bad bacteria because the antibiotics have wiped out all the good bacteria.
Sure. Yeah.
So yeah, very important when you take an antibiotic, take a probiotic. I would take a probiotic if you're going for a bowel cleanse, like if you're doing an enema, if you're doing a colonoscopy prep. Afterwards, you definitely want to recolonize. That's a reset. That's a fresh start. You might as well recolonize with some the good probiotic to recolonize
Sure.
your
Yeah.
bowel. Um,
Okay.
yeah.
Interesting.
Yeah.
Yeah, I think that is something that I'm hopeful will continue to infiltrate into mental health care. I mean, physical health as well, right? I think we know the gut is connected to every part of the body. Hippocrates says
Right.
all disease begins in the gut. So we know that to be true, but especially as it relates to mental health and anxiety and depression and how unfortunate it is that there's so much dysfunction going on and inflammation that exists within the gut that I'd imagine is generating symptoms of
Sure.
anxiety
Sure.
and depression and we're reaching for the medication or we're reaching
Right.
for, the cognitive support or the coping
Yeah.
mechanisms which can work in some capacities, but if we're not looking at the
Right.
root issue,
Right.
how can we really address the issue if
Right.
it's something that's not being touched on, you know?
Exactly. Exactly. So the gut has an important role in filtering out harmful bacteria viruses that we do consume. There's a layer of deep, there's a lymphocytes or white blood cells, very important B and T lymphocytes. They're waiting and in ambush, so to speak,
Sure.
behind the uh, colonic intestinal cell layer to
Right.
catch any intruder, any virus or bacteria that kind of breaks through. That's called the leaky gut. You've heard this term, leaky
Of
gut, where
course. Yes.
where your cells separate, and then the bacteria, the bad bacteria, and the viruses kind of intrude, and then it's up to your immune. If you don't have a good immune defense, you're vulnerable to this infection, and
Sure.
inflammation. So having an intact colonic cellular lining is important, for our health and well-being.
For
Yes.
sure.
Yeah.
Yeah,
Yeah.
absolutely. I couldn't agree with you more on that.
Speaking of inflammation, let me give you my top three natural, over the counter,
Okay.
safe, anti-inflammatories that we all should flood our bodies with. So
Let's hear it. I'd love
in,
that.
in no particular order, but I would say omega-3 fish
Okay.
oil, basically. If you're taking a good fish oil with EPA, DHA, that I would say that's been shown to help with a lot of psychiatric illness, actually, just by
Sure.
reducing inflammation in the brain. So I would say number one, we need to supplement. We can't get enough omega-3s. Even if you're eating salmon and tuna and chia seeds and walnuts, even if your diet is just still need to supplement. I would still recommend a fish oil supplement.
Okay.
Number two, I would say CBD.
Okay.
So CBD, we now know of the effects it has on concussions, Alzheimer's disease, brain
Mm,
inflammatory conditions, bodily inflammatory conditions, very potent anti-inflammatory.
okay.
And then the third, I would say turmeric,
Yeah.
curcumin. Turmeric, just you need fat and black pepper to help the absorption.
Yeah. Yeah.
I like the taste. I think it works perfectly on a steak because on the
Yeah.
steak you've got the fat, you're putting the black pepper on it, and then you
A
sprinkle
little
this
bit of turmeric. You're
little
good to go.
turmeric. You're good to
Yeah.
go right there.
Yeah.
CBD,
Yeah.
turmeric, fish oil, flood our bodies with it, we'll live to 100.
Okay. Thank you for that.
Yeah.
Definitely important. And I couldn't agree with you more. The CBD obviously was not something that necessarily first came to mind, but what about the CBD are you finding
So
is
CBD is hemp. It's legal from the hemp plant. It just the way things have evolved in nature. The marijuana plant or the hemp plant, the cannabis plant, was 1-to-1 THC CBD selectively over the course of years. So the THC was bred out of hemp to make it officially legally hemp, which is zero point 0.3 or lower of THC. And then the marijuana, they bred out the CBD just to get high levels of THC, just to get people stoned. Where ideally I recommend at least 1-to-1 ratio of THC
okay.
CBD. They kind of work together. The CBD neutralizes the THC side effects. And then it's the healthy, it's the medical marijuana. Although
Sure.
THC is, and then there's other ingredients, alkaloids and terpenes that we call it the entourage effect. You need them all kind of working together as opposed to isolated THC or CBD. So CBD, it work. How does it? Well, it works by enhancing our own endocannabinoids. So we have an endocannabinoid
Sure.
system. It's similar to the opioid system. It has receptors, it has neurotransmitters, and it has degrading enzymes as well. CBD seems to block the degrading enzymes, so it helps our natural endocannabinoids. We have our own cannabinoids,
Sure.
neurotransmitters, anandamide and 2-AG. It helps them work a little more by preventing the degradation, the breakdown of it, similar to the way SSRIs, antidepressants work.
Okay.
So our endocannabinoid system is designed to induce homeostasis in the body. So it brings everything kind of back to normal. It
Sure.
turns off things, it turns on other things. It's interconnected with all systems in the body. Very important uh, system to
Hmm. Okay.
utilize, and hopefully a future source of medications. So there is one FDA approved whole plant extract CBD oil approved for infantile seizures. It's called Epidiolex. And so hopefully there'll be more along those lines developed along the way. I'm sure
Yeah.
we're working on it right now.
Yeah. Yeah, for sure. Absolutely. Very interesting. So tell me a little bit, we'll transition a little about metaphysical psychiatry.
Yeah,
I want to hear about that.
so you need to take, I like to take a holistic approach, to
Mm-hmm.
the patient. So the metaphysical is more the spiritual,
Sure.
uh, metaphysical. I would lump that in there, together. Very important. Um, what I would include in metaphysical psychiatry would be things like energy healing,
Mm.
the practice of Reiki.
Okay.
Now, we're all made of energy. We're condensed energy. So, Einstein famously discovered E equals mc squared. So, compressed energy makes matter. So we're actually pretty porous, our bodies, as far as our atoms. I mean, X-rays can just go right through us, basically. So we're basically made of empty space, due to the subatomic, particles, and how that kind of works out. So, yeah, right, I'm trying to build the basis for the use of energy, Reiki, and energy healing. Yeah, so
Okay.
it's scientific. It's not woo woo.
Sure.
There's a way to balance our energy,
Sure.
remove blockages.
Yeah.
Familiar with the chakras. Now, the chakras
Yes.
are if you're going to use Western medicine to debunk the chakras and all, I mean, then you're what are you saying about the people who've used it in the Orient for years and years?
Mm-hmm.
The chakras, that we're just going to, dismiss,
Yeah, right, right.
decade, centuries.
Yeah.
So a Reiki treat. Now I'm certified in Reiki, so I know how to do it. I don't use it in my private practice. In psychiatry, I do recommend it, and I refer out,
Okay.
pretty much. But Reiki would be one of the metaphysical treatments. The other being meditation. I would say
Okay.
would include meditation, which has shown to be effective in many different, ailments and illnesses, particularly anxiety.
Mm.
So the best treatment for anxiety and anxiety conditions such as obsessive compulsive disorder, panic disorder, generalized anxiety disorder, uh, I think is meditation. It's a skill.
Hmm.
As
Yeah.
opposed to popping a Xanax, you will note that your mind is in overdrive. You're spinning
Sure.
weird. You're looping. If you're familiar with this term, the default mode network is
Hmm.
in overdrive. It's what we think is the basis of what we're starting to see is the basis of possibly the cause of depression and anxiety. It's just
Sure.
how when our brain is a poor master, but a very good servant. It's a
Mm.
computer. We tell it what to do. We give it a problem, it computes it, spits it out the answer. That's how we're supposed to use the brain. Not that the brain that we're the victims, of our brain and
Sure.
looping and thinking. So ways to short circuit the default mode network, meditation and psychedelics. Maybe we want to talk about that later. But as far as meditation, there's many apps in the app store. Uh, it's a way to stay present, get refocused in the present moment, anchored to things that are always there, like our breath and our
Sure.
senses. We feel our chair under us. We see things. We hear things. We
Right.
alert. So meditation short circuits the default mode network and brings us back into the present moment. If we're out of our heads, and I like to say out of our heads into our bodies,
Yeah.
we're actually connected. We're reconnecting.
Yeah.
So very, very important.
Yeah.
Meditation and Reiki. I would say that would be my prescription,
Okay.
to add the
Yeah.
metaphysical part into it.
Yeah. Yeah. I love that. I think with meditation, it's fascinating. And you had mentioned breath work and using our senses. These are skills that we all have available to us.
Yeah.
And I didn't learn much about the metaphysical until I started working for the private practice that I was working for. And my boss, my supervisor, was very big into Joe Dispenza and, you
Good
know,
sense. Yeah, yeah, yeah.
learning more about quantum physics and all that. And that was all very new to me. I really had no idea what I was getting myself into. But since
Right.
then, I've really
Yeah,
explored more about, you know, understanding this, not necessarily in the work I was doing with clients as a therapist, but in my own life
yeah,
and
yeah.
understanding meditation and manifestation and so forth. But when it comes to meditation for anxiety, I think that's another one of those
Yeah, yeah,
skill sets that people
yeah,
have a
yeah, yeah.
hard time
Hard time. Oh, I
grasping.
can't meditate.
Yeah.
Be kind to yourself. Be
Yeah.
patient. That's okay. Even Zen masters have to work on it for hours
Right. It's a muscle, you
because
know?
the brain just wants to think. That's what it
Yeah.
does, kind of thing. So the idea is just to kind of note, catch yourself. I'm
Sure.
thinking, all right, let it go, back to my breath, I
Yeah.
think, and just keep doing that.
Yeah.
The mind can only think of one thought at a time. So one
Sure.
thought pushes the other thought out.
Yeah.
The key to meditation is to gradually expand the time, the stillness
Mm.
between thoughts, bask in the
Mm-hmm.
stillness,
Mm-hmm.
I like to say.
Mm-hmm.
I think.
Yeah. And I
Well,
tell I tell
yeah,
clients that too, and even now as a coach, I still recommend meditation and I support clients in that. And I tell them it's not about being good at it. It's not about not having any thoughts at all. I said that's not possible. You can't control our thoughts are automatic. They come to our brain no matter if we want them to or not. But it's also just about when those thoughts do come up for you, acknowledging it, right? Not placing judgment on it and then letting it go. And if it comes up again, doing the same thing over and over again. And that's where that skill set develops. It's not about being a clear-minded person and not having any thought at all, right? That's not the point. The
right.
point is to be present and
Yes,
just be
yes,
able to
yes,
repeat
yes,
that process and like
yes,
you're saying, expand the amount of time.
yeah. So yeah, I was going to make a point here about the meditation, about the thoughts. Yeah. Oh, so you had mentioned clients are thinking they can't meditate, that their thoughts are overwhelming. Okay. The question I have is, so who's listening to these thoughts?
Mm,
Who we are not our thoughts. We're the
yeah,
observer behind our eyeball. We are whatever we are, our essence, our energy packet, little quanta of energy that we have inside us, deep in our brains. Maybe we're the pineal gland, the seat of intuition. Maybe that our brain stem, our automatic functions. Maybe that's who we are. Who knows? But we're not our thoughts.
sure.
So we're observing the thoughts. So you have clients that have these thoughts that kind of come and go. It's up to us to interpret. We're the boss. We're the master of our thoughts. It's up to us to interpret. No, that doesn't work. Gone. Let's get the next one in. No. So meditation apps, there's many in the app store, and they use very good visuals and descriptions of animations of how to envision this.
Sure.
Some people think it's the blue sky is always there, the
Yeah.
stillness, and the clouds kind of come and go.
Mm,
It's these dark thoughts.
yeah. Or a leaf on
And
a
wait,
stream. I know that's a big one too.
which one?
The leaf on the
Leaves on a
stream.
stream, leaves on a
Yeah.
stream, cars on a road. Let them pass. There'll be another.
Yeah.
Just get used to this rhythm and widen the space between.
Mm-hmm. Mm-hmm.
Stillness kind of thing. Yeah, yeah.
Yeah.
So,
So, what do you think are the shortcomings within mental health and mental health care in our country? What would you say that you think is the shortcomings that we see in our practice?
well, I would say it's just not a priority.
Yeah.
It can't be quantified and it can't be regulated and monetized in a certain way.
Sure.
The way like a colonoscopy, cataract
Yeah.
removal,
Yeah.
hip replacement, knee replacement. Boom, there's a dollar value. That's how much it is. That's the way everyone should be charging. Mental health, it could go on and on and on. And who
Right.
knows if someone's going to have a crisis or something.
Right.
So instead of acknowledging that, it's decided it's been decided that it's a luxury.
Yeah. Oh,
Like seeing
without
a
a doubt.
like seeing a plastic surgeon. I
Mm-hmm.
equate the outlook, the perspective on mental health to be a luxury as if it were going for plastic surgery. Yeah. I
Sure.
mean, so when in fact now, since the pandemic, the mental health, the global mental health crisis probably will cost more than all other medical illnesses combined.
Sure. Yeah.
Right now, major depression is the number one worldwide cause of disability,
Mm.
and young people in my practice, what I'm seeing, young people are really suffering. The
Yeah.
anxiety is through the roof. They have
Yeah.
this learning loss, whatever happened in COVID, whatever. Uh,
Sure.
and uh, and now, but they don't see a future. That's the thing.
Yeah.
And people do not
Yeah.
see a future. They can't buy houses, the inflation, this and that.
Right.
So they're bugging out. Yeah. So
Yeah, absolutely. Oh my goodness. Yeah, definitely. And I appreciate that honesty if it's simply just not a priority. It's a
it's not a
luxury.
it's not
Yeah.
it's a luxury. Yeah, it's a priority. Yeah, I think.
Yeah.
Yeah, yeah, yeah.
Yeah.
So yeah,
So speaking of the pandemic,
yeah,
what shift
yeah.
have you seen in your work now that we live in a post-pandemic world?
I've gotten very busy.
Yeah. Mm-hmm.
Yeah, people are hurting. People need help. And the advent of telehealth and specifically in psychiatry, recent study, psychiatry has been the specialty that has adopted telehealth way beyond all other specialties
Sure.
combined,
Sure.
probably, most of my patients, I see it, telehealth, unless they come in for the infusions, for the ketamine infusions. Some still like to come in person. That's perfectly fine. But I would say most, just because of the convenience,
Yeah, of course.
the telehealth has been very convenient. So that's been helpful, and its rise was due to the pandemic. Um, I just coincidentally just happened to be developing my intravenous ketamine program during the pandemic, and
Okay.
so I rolled it out, during that time as well. So it's come in handy because it's been useful, to at this time of need.
Sure.
What else? Some other things that have had. What else? I mean, the coincidentally, the pandemic has happened in this renaissance of psychedelic medicine. So I don't know if you're aware, in 2006, a very famous researcher from Johns Hopkins, his name is Roland Griffiths. He's recently passed on, but he ushered in the renaissance in psychedelic research by
Okay.
conducting some studies with psilocybin. And since then, there's been further developments in public companies testing it on with their proprietary products. And another big thing with psychedelics has been the book written by Michael Pollan has
Okay.
increased. We call him the pollinator, in the
Mm,
psychedelic community. It's exposed more people to the idea. Very good book. I've read it myself. The first half deals with the whole history of the 60s and how it became illegal. And then the second half, he actually underwent several psychedelic trips, and he documented, his experience
okay.
as well. So, yeah.
Yeah, very fascinating. Very fascinating. So, how open do you find people are to work with you in maybe the non-traditional forms of care? Or are they
Well,
seeking you out for it? Is it something that they have to, kind of think about? Kind of give me the scoop there?
so we'll say medical marijuana has now become legalized in the majority of the country, and not many, if any, patients are asking for it as they did maybe 5 years ago or so, 5 or 6 years ago. Um, but I use it now as a tool.
Okay.
It's a medicine.
Yeah.
I'm having trouble sleeping. Here's a gummy. It's CBN and indica THC. That is how I've adopted that. Now, psilocybin has been in the news, and I'm getting most of my phone calls, referrals for psilocybin. Now, I have to
Okay.
say it's not available, it's not legal yet. You need access to it. You got to be careful because it is not legal, so we don't know who's growing it, what kind
Right.
of herbicides they're using on the
Sure.
mushrooms as well. And then they sell these chocolate bars with mushrooms in it in some of these shady smoke shops, the
Yeah.
Delta 8, Kratom, the sketchy products that they under the counter they sell these
Sure.
magic bars with 5 grams of psilocybin. So that's the problem. Growing mushrooms is legal because the spores are legal. You can get the spores from a company like SporeWorks online. They're legal, and you inoculate a growth medium. There's ways to grow it. There's a double-blind magazine. My website, I have some handouts on it. They'll instruct you on how to grow it, and if you grow it, you're discreet. That's probably the best way right now to access it. But unfortunately, I have to turn down all the phone calls and I recently clarified my website. I said, look, we're waiting for these products to come out.
Sure.
Alternatively, we're waiting for the state of New Jersey to allow legal administration in a therapist's office, the way Colorado, Oregon are doing it. And that could be 2 years, so there is that's been an issue, So MDMA may be the first psychedelic to kind of come out, and because that's been filed with the FDA,
Okay.
that MAPS has been working on this a long time, seems to be very effective for PTSD.
Okay. Yeah, I remember learning about this a little bit in grad school. I had a professor who she's very big on this, is very openly sharing it with us on, this is probably 2018, 2019, on the research and her thoughts on it and her excitement for it. And I remember her talking about the connection with PTSD and MDMA. And all of us grad students being like, oh my gosh, this is crazy, but really, really neat to see what's happening,
Sure,
and
sure.
what could be the future,
So MDMA is a supercharged antidepressant. It enhances serotonin, dopamine, norepinephrine, which is typically what antidepressants do. Plus, the magic ingredient enhances oxytocin. So
Okay.
that's the love chemical.
Yeah.
That they've used that in the past in couples therapy.
Okay.
You just want to like hug everybody.
Yeah.
They're actually looking to use it in international diplomatic relations.
Okay.
They want two warring countries to take MDMA, sit down at a table, and negotiate a treaty kind of thing.
Interesting.
Yeah. So
Interesting.
hopefully that maybe we'll find a use,
Yeah.
Yeah.
Okay.
Um,
So I'm curious to know, given the nature of the field of psychiatry and how, obviously, like we've spoken on traditional route of care is pharmaceuticals.
right.
And if you're taking more of a whole body holistic approach,
Yeah, yeah, yeah.
does that how does that influence your role in the world of psychiatrics, I guess, as is my question, in comparison to those who maybe are very by the book and use, medication primarily versus someone like you who's going more holistic route, which kind of steps away from the pharmaceuticals, but still uses the pharma. Are you understanding my question there? I'm just curious about that kind of discrepancy or that dissonance that might be there.
Well, less and less
Hmm.
dissonance as more and more patients inquire and ask their practitioners about psychedelics. Yeah.
Sure. Yeah.
So, and they're at a loss, and they're scrambling now for education
Yeah.
to learn about these things, and they don't want to be left behind the curve either.
Yeah. Sure.
So, I think less and less, start, I would say that it's being adopted,
Sure.
and as the studies and the evidence mounts of their effectiveness, I mean, even more, you can't deny it. So, many, I like to call them celebrity psychiatrists. These are the psychiatrists, the top nationally known psychiatrists who consult for all the pharmaceutical company. No, they're even kind of agreeing with the use of psychedelics, MDMA, and
Sure.
psilocybin. Yeah, they're on board as well. So I think less and less. It's still highly specialized,
Sure.
and it's expensive, and
Yeah.
insurance doesn't cover it, so it
Right.
limits the availability. Now, the hope is for equity, and the hope is to uh, right the wrongs of past incarcerations and charges that have devastated. The war on drugs has devastated
Sure.
generations of people and has done nothing to stop
Mm.
the use of
Mm-hmm.
illegal drugs.
Mm-hmm.
Some countries have seen that, specifically Portugal, when
Mm.
they decriminalized all their drugs. It didn't change the rate of people who use them. Same
Sure.
people use them before or after. I just didn't. Yeah. So
Yeah.
criminalizing drugs. Now, Oregon wants to had decriminalized them, legalize them. Now wants to criminalize them again. Um, I could see that in the world of addiction. Um, uh, it's very difficult to help people without leverage.
Yeah.
So the threat of probation, incarceration can be used for good purpose to get people to sober up.
Sure. Sure.
So yeah. Yeah. What
Okay.
was the question?
Yeah.
Uh,
No, that was great.
Okay, good. So,
Yeah. It's funny you say that. I actually studied abroad in Portugal for my
uh,
grad program, and the
nice,
professor that I
nice.
just spoke
Yeah,
of,
yeah,
she
yeah, yeah,
she spent a lot of
yeah,
time
yeah,
every
yeah,
other year. We
yeah,
would spend
yeah,
the time spent there was focused on drug and alcohol focused classes,
yeah,
and then another
yeah,
year it was just based on general education classes. So I unfortunately was only there for the gen ed classes. I didn't actually get to partake in any of the more
yeah,
specialty
yeah,
focus for substance use, but that's a
yeah,
big part of the program was
yeah.
focusing on because of the fact that they were decriminalized in Portugal. So it's funny that you say that.
Nice. Now, we should say psychedelics, including ketamine, have anti-addictive qualities. And that
Okay.
was one of the studies that Roland Griffiths at Johns Hopkins did on smoking cessation. After three psychedelically dosed, high dose treatments under therapist supervision, every other week, they did it for 3 sessions. They had an 80% success quit rate in smoking cigarettes
Wow.
in smoking cessation. Um, and we could go on why that is or what, but yeah, there is potential that the psychedelics actually not only are non-addictive, but they're anti-addictive.
Anti-addictive, yeah.
Yeah.
Okay.
So yeah, yeah.
Interesting. So, what do you see as the future of mental health care? What is your vision?
So the future would be legalization, acceptance, and availability of psychedelics that will be commonplace, that would be standard of care, that would be normalized. It would be part of the tools in our toolbox that we all have,
Sure.
Um, I think there'll be more emphasis, more funding, more appreciation of the benefits of mental health,
Sure.
mental health days, for work in corporate environments. Um, and the importance of mental health in the healthcare industry is, believe it or not, it's really given shortchanged in
Mm,
healthcare, mental health.
okay.
Uh, So a lot of workers, especially after COVID, a lot of workers are suffering, emergency room workers, and people are leaving.
Yeah.
There's
Oh, yeah.
shortages of mental health providers. Yeah.
Okay.
There's a high rate of burnout,
Mm-hmm.
and that's a whole another topic.
Yeah.
But I
Yeah.
hopefully it'll be funded. It'll be more accepted. Uh,
Sure.
you know, you'll have a primary care doc. You'll have a psychiatrist or mental health provider.
Sure.
Um, so so
Yeah. Yeah. No, I really hope to see that as well, for sure. It's widely needed. If you were to offer the audience three suggestions on how they can improve their mental health through
right.
lifestyle and nutrition, what
Yeah,
would you
yeah, yeah.
say?
Okay, so eliminate ultra processed foods, number one. Eliminate the damage before you even undertake supplements and
Sure.
exercise and keto and fasting. You've got to look at what your current diet is and eliminate all soda,
Yeah.
eliminate all empty calories, chips and cookies. They do nothing for us,
Sure.
other than
Sure.
increase inflammation and create medical conditions. By the way, this is what's bankrupting the healthcare system.
Totally.
I mean, we're working at cross purposes with purveyors of junk food, people getting cigarettes, alcohol, people getting sick and causing all kinds of medical illness, and expecting Medicare, to cover
Sure. Sure.
endless days in the intensive care unit after a lifetime of smoking, drinking, and sugar. Yeah, it's no wonder that you're in an intensive care unit at the age of 40, dying of
Mm,
heart attack at
mm-hmm.
40, 45.
Mm-hmm.
So we're up against this. So yeah, there's really nothing you could. So basically, the process of elimination, I would say, before even ultra processed foods, probably would okay. This is important. I'm going to remember it here. I wanted to get this in tonight. In order for us to lose weight, we have to get healthy first. We
Sure.
can't go on diets.
Yeah.
GLP-1, the GLP-1, you know what these are.
Yes.
Yeah.
Yes.
GLP, oh, it's a miracle. Just eat and
Mm,
drink and smoke, whatever you want, and
just
then just take a
take
GLP-1.
the shot. Yeah. Mm.
Don't worry, we got you covered. You got covered.
Very
$1,500 a month.
American-esque of us, though. We can't deny that, right?
Yeah. So you have to. So number one, if you're smoking cigarettes, forget about exercise, diet, supplement. You got to stop smoking cigarettes. There's really nothing we can do unless you stop
Sure.
smoking cigarettes. If
Sure.
you're an alcoholic, you got to stop smoking. You got to stop drinking alcohol. There's nothing we could do, to save you. Nothing's gonna reverse the damage you're doing from cigarettes, alcohol.
Sure.
And then number three would be the ultra processed foods, the sugars and the carbs, simple carbs, to eliminate those. So number one, you got to eliminate.
Okay.
So number two would be, so you heard the term, six-pack abs are made in the kitchen. You heard
Oh,
this term.
yes.
Six-pack
Mm-hmm.
abs are made in the kitchen. So before you start working out like crazy and hire a personal trainer, you got to get your diet, under control. So
Totally.
um, There are essential amino acids and essential fatty acids. Essential means our body can't manufacture them. We have to externally supplement them every day.
Sure.
And we need, so there's, I believe 20, 21 total amino acids, 8 or 9 are what we call essential. We need to take them in every day in order to make a complete protein. If we have just some of them, our machinery to make muscle will break down. So
Right.
we need the essential. So you need high quality proteins, hopefully free of hormones and additives, antibiotics. I mean, again, that's if you want to take it another level, but if not, if you want to go on, you've eliminated the bad stuff and you want to go on keto, have a steak. Doesn't matter,
Sure.
you
Sure.
know. Um, so yeah, so then we want wholesome food. So essential amino acids, some good pointers for your audience. The complete proteins are found in steak and eggs, rice. The combination of rice and beans provides that as well. But on the other hand, the omega fatty acids. So we need to supplement with fish oil, with salmon, cold water fish, the mackerel, tuna, sardines, anchovies, uh, walnuts, chia seeds, hemp seeds as well. Very good for the omega threes. So food wise, we want to have a clean diet with the essential fats and proteins. And then number three, I would say would be activity.
Yes.
So much exercise. So it's been shown that just walking is fine. Going
Yeah.
downstairs, being active. You don't got to sweat. For you to get sick back ab, you got to be in the gym 24/7. You got to starve yourself. No, that's not going to do it. Just be active to
Sure.
to start. And then if you want to take it up a notch, and you want to do a Pilates class, you want to, lift,
Yeah.
then you could do it. But just start being active, limit,
Yeah.
so again,
Yeah.
meeting people where they are on their
Sure.
kind of thing.
Yeah.
So
Okay.
a patient who comes in to see me, there was one patient, I can't disclose any names, but I had one patient, would just say, hypothetical patient, who was very depressed. I had her on 4 antidepressants, that I tried to complement, that they tried to complement each other. Nothing was working.
Mm.
Had to dive a little deeper. Found out her diet consists of cigarettes and Coca-Cola. There was no food in
Mm.
her refrigerator except, a case of Coca-Cola and cigarettes.
Wow.
How can I treat somebody like that? They don't have the
Yeah.
building blocks. They don't have the tryptophan to make the serotonin to
Sure.
feel
Sure.
good. That's why these medicines were doing nothing.
Yeah.
So yeah, that was an eye opener for me.
Yeah.
When I
Well, and
saw,
I'm sure it's also hard too when it comes to depressed patients because the lack of motivation to even wanting to eat
yeah, yeah,
and wanting to move is just it's a very real thing. So having that up against, to be up against something like that where clients who are severely depressed who have no motivation to even get out of bed in the morning and then trying to encourage
yeah,
them to eat real foods and to move and so forth. And
yeah,
there's research to suggest that movement is it's likened to antidepressants and the impact that that can have. So, that's such a dilemma and such a difficult spot to be. So I'm sure that played into it as well. If she's not eating, she's
yeah,
only
yeah, yeah.
drinking soda
Yeah, yeah,
and yeah.
exactly, exactly.
All right. Well, anything else that you'd like to share with the audience before we wrap up for this evening? Any other thoughts to share?
Well, I just want to thank you for your
Yes.
advocating for and emphasis on nutrition. I think that's very important. Getting us back to the basics of maybe planting our own garden, with our own composting, eggshells, banana peels, and coffee grounds.
Mm, mm-hmm.
And having a small garden. All we need is a little dirt, patch of dirt, and grow, tomatoes or whatnot. Way better than anything you buy in the supermarket. I think that's important. Uh, what's the fellow I like to listen to? The Doctor's Pharmacy, I think his
Oh
name.
yeah, Dr.
What's his
Hyman.
Hyman, yeah, yeah.
Mm-hmm.
He's good. His idea is brilliant. He wants to
Yeah.
bring the food, the farm to the hospitals.
Yes.
to the sick
Yes.
people. He wants to bring the good food to the sick people, kind of to
Yeah.
help them as their medicine. Yeah,
Mm-hmm.
yeah.
Mm-hmm. Yeah. I like Dr. Hyman. He's great and he's very passionate and very to the point about what's going on. So we need that. We need more of him.
Besides him, his podcast, I would also recommend Dr. Eric Berg. He's on
Okay.
YouTube. Eric Berg, believe, is a chiropractor, but I agree with basically everything he says
Okay.
for supplement diet. And Tom DeLauer, he's a personal trainer out in LA.
Okay.
Also very good, well read, well respected. He's good with exercise plus nutritional advice. These guys and Mark Hyman, I think his name is
Yes.
Mark Hyman.
Yes.
He's
Yeah.
very good. He's very good too. Yeah.
Okay. Great.
So
Thank you for those
yeah, you're
suggestions.
welcome. You're
Yeah.
welcome. Yeah,
Well, thank you so much, Dr. Gentile. It's been really great
welcome.
to
Yeah,
discuss
cool,
the ins
cool.
and outs of your field, your specialty, and I'm sure it's brought a lot of value to those curious in the audience about this new
Yeah,
emerging part of mental health care, and I'm sure we'll see more of it in the coming years.
yeah.
But thank you so much for being here tonight.
You're welcome. My pleasure.
Yeah.
Nice meeting you,
Yes.
and thank you for having me.
Yes, and to everyone listening, thank you so much for tuning in. I'm so grateful that you are here, that you were listening, and I hope that you took a lot away from tonight's episode. And until next time, be well.
Thank you very much.